Open a public hearing on House Bill 2304. We're keeping you busy today.
Yes, yeah. This is an exciting first meeting, Mr. Chair.
The next two bills will be a little more complicated.
Mr. Chair, members of the committee, House Bill 2304 comes before us today at the request of the Oregon Health Authority again. This is adding peer support specialists, which includes a family support, youth support specialist, to the current definition of peer wellness specialist. It also defines family and youth support specialists. It directs the Oregon Health Authority to adopt rules with the qualification criteria. This bill has no revenue impact, minimal fiscal impact at this point. Mr. Chair, about 59 minutes ago, we posted a -1 amendment that Rep. Kennemer had drafted on behalf of the Oregon Mental Health Consumer Association. It should be up on OLAS. I believe we also put hard copies on the dais for you, just in case you wanted to review that. I have not had a chance to look at it. Maybe Rep. Kennemer has a sense of what it was.
We'll do a hearing we'll do the public hearing on this bill, and then we'll suspend it. We'll get back in action later when we have a chance. So.
Okay.
That will also probably be part of the discussion too, Mr. Chair.
Exactly.
So, do you want panels of 3, Mr. Chair, or?
This makes it reimbursable.
Good afternoon, Representative Greenlake, Chair Greenlake, members of the committee. I am Nicole Corbin. I am the Adult Behavioral Health Services Manager for the Health Systems Division of the Oregon Health Authority. Maybe I'm not quite as proud as Greg, but I am proud. We do good work. And I'm pleased to be here for the opportunity to testify in support of House Bill 2304. Just to give you a little bit of historical context, in 2013, House Bill 3407 established the Traditional Health Worker Commission. That commission provides a registry of traditional health workers in order to allow these services to be reimbursed by Medicaid. At the time, it was believed that peer wellness specialists were the same as peer support specialists. The field has developed more specialties since then, and we now know that's not the case. When the Traditional Health Worker Commission developed rules, policies, and procedures, peer support specialist was included. But since then, as I said, subspecialties have developed within the profession. This bill acknowledges those specialties and takes definitions now already existing in rule and adds them to the statute. Both the Traditional Health Workers Commission, through the Office of Equity and Inclusion, and our Medicaid partners identified the need to name traditional health care worker types in statute. Medicaid already includes peer support specialist as a payable service provider, as does the Joint Center for Medicaid and CHIP Services and the Substance Abuse and Mental Health Services Administration. So what this does is adds peer support specialists to the list of traditional health workers originally named in the 2013 legislation. It also identifies family support specialist and youth support specialist as worker specializations of both peer support specialist and peer wellness specialist. This gives statutory authority to the rules promulgated by the Health Authority through the Office of Equity and Inclusion, the Traditional Health Workers Commission, and Integrated Health Systems, Medicaid. And this updates the definition of worker types to reflect best practices and registry requirements set by OHA through the Traditional Health Worker Commission and Medicaid. This legislation does not cause any increase to Medicaid costs, since these worker types are already providing services through CCO payments and Medicaid reimbursements. It doesn't change any requirements for criminal background checks for public safety. These worker types are still required to have those checks at the same level. And there's no change to current policies and procedures of Medicaid and Traditional Health Workers Commission. Oregon Health Authority supports this bill, and we hope that you will as well.
Are there any questions of the witness?
Mr. Chair.
Rep. Kennemer.
Representative Kennemer.
Thank you. I was approached by the Oregon Mental Health Consumers Association, and they said that some of these services without the amendment that I had drafted would not be reimbursed. What's your view on that?
I haven't had a chance to see the amendment yet, Representative Kennemer and Chair Greenlake. But I will say that right now, all CCOs are capitated to provide peer services. There are open encounter codes for the full spectrum of peer services within the Medicaid system. We're tracking the amount of peer services that are provided as part of the Oregon Performance Plan with the U.S. Department of Justice. So if there is a need to add additional specific language, that's certainly something that we would be open to consider.
If you'd please Excuse me. Thank you, Mr. Chair. If you'd please take a look at that amendment and see if, and review whether it's necessary, it'd be much appreciated.
Certainly.
Any other questions? Yes. Representative Geyer.
Thank you, Chair. I'm just delighted to see this evolution. I was involved in setting up the Traditional Health Workers Commission, and I'm glad that the field is continuing to evolve to use peer services. I would love to see that report that you talked about of how CCOs are using the peer services. Thank you. If you can maybe send a copy to the whole committee.
Certainly.
Okay. Thank you very much. We have some witnesses to join us. Will you call the first panel, please?
Mr. Chair, we're calling Carol E. Richards, Sandy Bumpus, Sharon Kuhn for the first panel.
And who's the next panel?
On deck would be Candace Arnold, Lisa Butler, and Kevin Fitz.
I would urge you to take every bit of time you need, but not a single bit longer. Please introduce yourself.
Short and sweet.
I appreciate that. Chair Greenlick and representatives. I'm Carol Richards, Salem, almost to Turner, and a parent. I represent a group, family leaders, composed of people that hope to support this and other legislation that moves peer support and services to families forward, and we are in support of House Bill 2304. Have not seen the amendment. Got here early. My mistake.
We'll hear about the amendment with the next panel, I think. Next, please. Thank you.
Chair Greenlick, Vice Chair Noss and Hayden, and members of the committee. My name is Sandy Bumpus. I am the Executive Director with the Oregon Family Support Network. We are a nonprofit organization that hires family support specialists all around the state of Oregon. Today we have about 43 individuals who carry that role in the system. We obviously support this bill, and we think this is a huge step forward. We think that the role of peers and family peer support specialists play a critical role in the system, and how we do that in our organization is that we actually really provide a lot of support, skills development, and advocacy, and teaching families how to advocate for themselves so that they actually can have a better future and be successful in their lives. So we support the bill, and thank you for the opportunity to testify before
People you hire currently are not a part of the membership of that?
They are.
They are already?
Could you repeat your question, please?
Well, the bill purports to add peer support specialists and family support specialists to the membership of the Traditional Health Workers Commission. I was asking, they are currently not members of that commission.
Yes, I'm sorry, yes. That's correct.
Simple question. Thank you. Yes, please.
Hi. Is this on?
My name is Sharon Keene, and I'm the chair of the Oregon Consumer Advisory Council's Peer Delivered Services Subcommittee. And I'm here to support 2304. I really appreciate the opportunity to speak to you, esteemed representatives. This is exciting. What I particularly wanted to address is the amendment that's been added, which adds specific language that would have the Oregon Health Authority give a stronger direction to the CCOs to have peer support services available to all persons who are receiving public behavioral health services, and that would include the different categories that are being added. I am also a person who has worked in mental health, and I'm a person who's received services, still work on my own mental health, and also I'm an instructor of peer support services and have worked with lots of different organizations over the past 20 plus years. So what I really wanted to share is just briefly about the value of peer support services and why, in a time such as this, when funds are, potentially we're facing major cuts, why it makes so much sense to actually give a stronger directive about peer support. Peer support is an amazingly effective service to increase recovery outcomes. It reduces isolation for people who have been called mental health clients, people who have challenges in their life. Someone comes alongside them who is not judgmental in any way, is not above them in any way. It's a person who's also had the similar experience. And we train people around connection, around understanding others' worldview, so there's no judgment, about mutuality, and having a relationship about moving forward. And the impact is that people actually increase their self-responsibility. They have a better sense of themselves as agents in the world, that they can make choices that lead to better outcomes. All of this happens through peer support. It's a wonderful thing. We have more employment, more people pursuing education, less people in jail, less people in hospitals. Very cost-effective programming. I was the director of a program in California, which over a year, we had a peer bridging program, which is when people were discharged from the hospital, they were matched with a peer support specialist. And we saw a 72% reduction in recidivism. People did not go back to the hospital, 72% over the course of a year. The financial impact was over 300% return on investment, meaning that the small costs that we invested in training those mentors and providing a supervisor to support those mentors, that's what we called it, mentors on discharge, but it's really peer support specialists as we use the language here. But the impact was amazing, very big cost savings. So I'm saying that I really support, and the Oregon Consumer Advisory Council Peer Delivered Services Committee strongly supports a little more teeth to have peer support services available to everyone who chooses to have them. Thank you.
Thank you. Are there any questions of these witnesses? Thank you very much. Could you call the next group?
Candace Arnold, Lisa Butler, Kevin Fitz.
And who's on deck?
Bob Jundeff and Eva Ripito would be our last two, Mr. Chair.
Great. Any order.
I'll go first because, again, I'm Candace Arnold. I am a family support specialist from Oregon Family Support Network with Sandy, who does do great work. And I just wanted to come today to show my support for this passing because I think it directly affects what I do, and I appreciate the hard work of everyone that's put the time and effort into putting this up for you guys.
Thank you. Yeah.
Good afternoon, Representative Greenlick and other committee members. My name is Lisa Butler. I'm a mother of four. One of my sons experiences significant mental health and behavioral challenges, and I'm also a regional director for Oregon Family Support Network. I'm here in support of House Bill 2304 and the changes that have been described. I think it's really important to specify and clearly list out the different categories of peer support. So thank you for the opportunity to testify today.
Good afternoon, Chair Greenlick and committee members. My name is Kevin. I have this problem. No, I think I'm not going to.
No, you're fine.
Okay.
You're fine.
My name is Kevin.
And you don't need to be that close, Kevin.
Oh, okay.
Yeah, perfect.
Can you hear me now?
Yes,
My name
we
is Kevin Fitz. I'm the executive director of the Oregon Mental Health Consumers Association. I just want to tell you just a quick 30-second about some of my lived experience. I grew up in a childhood with a lot of adverse childhood events, trauma, divorce, alcoholism, mother, chronic physical disabilities, bullied in high school and in junior high terribly, dropped out of high school, ended up at 19 on the streets of Portland in Old Town, homeless, psychotic, ultimately ended up in Damisch State Hospital, which you might be familiar with, the Wilsonville grounds. Discharged into that to a group home right in Monmouth County, right near Monmouth. I was told there, at 20 years old, they said, Mr. Fitz, you will not be able to live independently. You have severe and persistent mental illness. You have the diagnosis of schizophrenia. You will not be able to live independently. You need to adjust to the idea that you will be living in structured and residential group home for the rest of your life. So I got kicked out of there for being the term medically non-compliant or difficult to treat. Everywhere that I encountered conventional major paradigm psychiatric services, I bolted. I left the United States Army Psychiatric Services on the East Coast and went AWOL. Ended up, like I said, in Old Town in Portland. Ultimately ended up in Damisch State Hospital, got committed by a judge in Benton County to there, and living in a group home. I got kicked out of that group home, got kicked out of another group home for being non-compliant, difficult to treat. It was there when I got kicked out of that and ended up back again in summer of 1985 in Damisch State Hospital with full-blown psychotic episode and schizophrenic symptoms, that I met a gentleman who was a recovering alcoholic and that had also had bipolar disorder. His name was Garrett Smith. Garrett Smith was the first executive director of an organization called the Mind Empowered Incorporated, which was funded by the federal government starting in 1988 to support the initiative of peers and consumers and individuals with lived experience supporting each other in their recovery and rehabilitation. Actually, there's a gentleman in the audience who was actually on the board of directors when I worked there, Bob Junda from the Disability Rights Organization. So that from there, I went on and got involved in consumer services, peer services as a clinician, as a peer provider. And then speed forward to I know we're running out of time. 1998, I was awarded a $500,000 contract with the Oregon Mental Health Division to promote peer services, consumer services, policy and advocacy services for people with lived experience all over the state of Oregon. To that fact, we had Senator Cruz come and speak at our 2000 conference, which was phenomenal. At that time, I was also serving on then President Clinton's Federal Mental Health Services Committee to provide the voice of consumers and survivors and peers. My life went in a ditch after I lost my job. In 2002, from 2002 to 2014, psychosis, addiction, houselessness, criminal incarceration, my partner being evicted because of my psychotic episodes, houseless on the streets of Oregon, Portland, et cetera, et cetera. So I was underwater for 12 years. And it was not conventional services that reached out to me and pulled me back and said, your life is meaningful. We don't want to see you ultimately living under a bridge or being, stuck in a backward of the state hospital. And those individuals who reached out to me were peers, were people who had the lived experience of houselessness, the lived experience of severe alcoholism, the lived experience of severe and persistent mental illness diagnosis. So it is now today back clean and sober for 3 years. There is nobody that you will meet who is not paid by somebody who is a volunteer, who's more engaged in mental health policy, unaffiliated with hospital associations, pharmaceutical money, or doctors' organizations that represent the authentic voice of the recipient of that service. I'm currently a recipient of Central City Concern in Portland, Oregon for my mental illness. The thing that I want to say is, and I want to give blessings to Representative Kennemere for suggesting our amendment. I was working on this exact same amendment with Senator Bates during last interim session, actually testified in front of Senator Moans Anderson, and he said, this is great, let's look forward to the next session where we can, spotlight this. I have been told by leadership of OHA, I just participated in a 6-month process called a Behavioral Health Collaborative, bringing together 50 stakeholders, county commissioners, psychiatrists, et cetera, to give some input of where Oregon Health Authority Authority will go in the future with its behavioral health integration to primary care. We yesterday abstained from endorsing their final report, not because we didn't think it was good community, not because we didn't think it was innovative and had a lot of fresh ideas, for one thing only. This particular recommendation that is in Representative Kenemir's amendment, we wanted that either to be put in the final document or to give a clear, understood, and explicit explanation by their business office and their contract people why this could not make it. We were, unfortunately, this was not in their final report. We weren't told exactly why it would not be. I have heard rumors that OHA leadership says that this particular language that lists in Representative Kenemir's amendment already exists. According to the director of Multnomah County Mental Health, who helped us craft this language, this does not exist. According to my scope and reading the coordinated care contract organizations, this language, this particular mandate, this definitive, is not laid out explicitly like that. We have great working relationships with Director Saxton, her behavioral health policy chief. All we are saying is take a look at this. We think that this would uniformly grow the field of peer support services from Pendleton to Klamath Falls across the state. So if I move to Grants Pass and my girlfriend gets a job at the university down there, I might be going there. And when I walk in the door, what we want with this initiative is that peer services, you get a psychiatrist, you get a case manager, you get a skills trainer, you get a QMHA, and you get a nurse, to be part of the basic package of your Oregon Health Plan recipient service. Since 1998, the federal government, in code, has made it allowable to bill peer services for Medicaid. Since 2005, before Obamacare, before the expansion of Medicaid, we have been doing it in Oregon. It has not been uniform, and there, as far as I know, and as far as my attorney, Brad Biddle, our organization's attorney, there's no contract law that mandates these 16 coordinated care organizations to offer this explicitly and out front in their contract. So I know that was an awful lot of wonky, in the weeds sort of stuff, but I just want to sort of lay that out there clearly.
We appreciate your passion.
Yes, yeah. So,
thank you very much. And we will consider that when it comes time. Are there any questions of this panel?
Okay.
Representative Kenny Geyer,
And then Bueller.
Thank you, Mr. Chair. That was
then Representative Bueller.
very passionate. Thank you for explaining.
Mine?
Yes. Thank you for explaining that. That was really incredibly helpful. And I'm wondering if you can help delineate the different kind of peer support, family support. There's a variety of different kinds, and there's, I think, different kinds of training, different kinds of certification. Could somebody explain that kind of briefly?
So the traditional health worker started out under peer. Three descriptions: PSS, peer support specialist, peer wellness specialist, and CRM, certified recovery mentors. And then to the addition to that, family support specialists as well. There may be some particular interest by the addictions community and the children's advocacy community to want to tweak some of this particular language to make sure that is equitable and represented uniformly and clearly and fairly in this particular document. But currently there are, so one is a peer support specialist, bridges, certified recovery mentor, and behavioral health sort of training, and also family support specialists and child support specialists. This isn't my particular field of knowledge. I'm just sort of a larger system loudmouth, but we do have other people who sort of could speak to this more directly.
I would say, if I could, the one thing I didn't hear you mention was youth peer support specialists, defining family from youth.
Representative Bueller.
Yes, thanks, Chair Greenlick. I'm really attracted to the concept. Is there published data to support this approach that compares it to other methodologies?
Certainly. I wanted to, and talking with Representative Kenemir beforehand, in our Dog and Pony show across the state, the spotlight is Clackamas County had a town hall, had a forum, brought together a whole bunch of different stakeholders. They ultimately created a position, an actual Clackamas County position, the peer services coordinator position. So what they wanted to do was look at some of the value of it, start meting out contracts, appropriating funds, redirecting it. Allie Linfoot, who runs that, has suggested that the reduction in criminal incarceration, use of hotline after hours, use of psychiatric crisis has dropped precipitously in the last 5 years that they have been rolling this out in Clackamas County. We can get you some more particular national studies that INAPS, the International Association of Peer Supporter Network, has, and some more of that if you would like us to send you some more documentation about that particular.
Yeah, that'd be wonderful. If you could get me peer-reviewed evidence, it'd be helpful.
Great. Thank you all very much. John Doff, is Riberto. Last panel, please.
It's kind of lonely up here.
Eva will she'll guide you.
All right, good.
She's tough. Any order?
Sure, I'll go. My name is Bob Jundeff. I'm Executive Director of Disability Rights Oregon. We support the bill. We support the -1 amendment. As Kevin mentioned, I've had a long relationship with the mental health consumer community. The model of drop-in center that I worked on years ago, is on the board on and worked with the staff of, demonstrated the importance of having people who can relate to other people who have the same condition, have the same needs, how empowering and helpful that is in keeping people in their lives. Since you are the healthcare committee, I just mentioned that, at least in my mind, peer supports in mental health are a model that's been replicated. It came from the substance abuse area, but it's been replicated in other areas of controlling chronic disorders, where people need someone to come who's not a physician but can be a community member, who's had the same types of experiences, can relate to the individual to help them manage their chronic condition. Mental health condition is a chronic condition, needs to be managed, and that keeps people out of the need for higher level services. So we support this bill. Thank you.
Thank you.
Chair Greenlick, members of the committee, my name is Eva Ripito. I'm with Oregon AFSCME Council 75. Thanks for the opportunity to show my support for House Bill 2304 and also the -1 amendments. AFSCME represents behavioral health workers, including peer support workers in a few locations. And I had the opportunity to hear from a large group of them when we had a behavioral health forum last Saturday. And peer support specialists were represented on our panel as well as in the audience, and they were really excited to have that recognition. I think that, everything everybody else has said previously about, the supports that they offer from the point of view that they've been through it is so crucial for helping people continue on their path to wellness. And that's why we're supportive of adding them to the Traditional Health Workers Commission, as well as the language to make sure that there is consistency in their coverage and access to it.
Great.
Thank you.
Thank you very much. President Cameron, do you want to comment on that amendment?
Well, we've had some testimony from people who are really more familiar with the internal workings of this than I. I suspect, in fairness, we probably ought to hear back from OHA. But I think we need to proceed with it, but we need to do that prudently.
Well, let's do that. I'll close this work session and carry it over till Friday.
Let's
give the committee a chance to
very
look at the amendment, and we'll ask OHA to, as soon as at least somebody back there hiding from OHA, be prepared to let us know whether you have a particular problem with the -1 amendments. So I'll close the public hearing, carry the work session over till Friday.
Oh, see, I leave and... Okay, just the work session till Friday, Mr. Chair?
Work session Friday.
Okay.
be invited testimony only, but